the brightest minds we have to provide you with a full briefing on the latest situation. I've asked our experts to provide you with the same briefing, the same information that I have access to as Premier. I want to thank Drs. Anderson, Donnelly, Williams, and Brown. These are some of the incredible experts that are working with us. And today, you saw some drastic numbers. These numbers are stark and they're sobering. They tell a story. These numbers tell the story of Ontario's fight against COVID-19. And the reality is, the early chapters of our story have already been written. And there's some things that are out of anyone's hands. But what matters is that the ending of our story is still up to us. And if we work together, we can write the last chapter of our story. Because these forecasts are projections. And they can change with your actions and with the government's actions. We've seen today that we can lower these numbers. We can slow the spread and flatten the curve. But as it stands, by the end of this month, we could see as many as 80,000 people in Ontario inflicted with this terrible virus. Over 1,600 people could be dead by the end of April. That's 50 a day, or that's 2 people every hour. Each one could be your brother, your sister, your mother, your father, your grandparents, or a friend. This virus could hit any one of you or your loved ones, because this terrible virus doesn't discriminate. It doesn't care about your race, religion, or creed. It doesn't care about your age. Anyone and everyone is at risk. We all have to ask ourselves, what is the cost of a life? Is a life worth a picnic in a park? Is a life worth going to the beach? Is a life worth having a few cold ones with your buddies in the basement? The answer is no. None of those things is worth as much as a life. So to everyone in Ontario, we need to listen. We need to listen to what the data tells us. We need to take action. We must take these warnings seriously. I can't stress this enough. The situation is extremely serious. And we must recognize that the numbers also show that everything we've done so far, everything we've done together since this started, is working. And thanks to every person out there listening to the advice of our health professionals, staying at home, keeping their distance, and doing what they can to keep this virus contained. The numbers clearly show that we have collectively saved thousands of lives. You have saved thousands of lives. But we also know that we can't stop now. There are 1,600 people out there who need us to do everything we can in the next 30 days to help save them. My government is prepared to take every step possible. And today, I'm asking you to do the same thing. We're moving as quickly as we can and acting immediately as the data changes. And today, we're taking additional steps to flatten the curve. We're announcing the closure of many more sectors of the economy. And I can tell you, this was no easy task. I know that businesses are struggling to stay afloat through these rough waters, but lives are on the line, and we must take this action now. Effective Saturday, April the 4th at 11:59 p.m., we'll be directing additional workplaces to close. All industrial construction except critical industrial projects will stop. Only necessary infrastructure projects like hospitals and transportation will continue. No new residential construction will start. Those few sites that will remain open will be placed under the highest level of scrutiny possible. We'll keep coming down hard on in the inspections. We have added over 60 new inspectors. We have hundreds of inspectors out every day. Over the last week, we have conducted 583 inspections. We've shut down 5 construction sites, and we will not hesitate to shut down more, because the health and safety of all Ontarians is my #1 priority. And if we take a step back, we can fully grasp what fighting this terrible virus has cost us. What it has cost us as a province and as a people. We've all had to make tremendous sacrifices, and none more than our frontline healthcare workers. But everyone has had to pay a price in this war. Daily life has ground to a halt. Companies, workers have lost their livelihood. And with today's closures, we've told the vast majority of Ontario's workforce to stay home. We've had to do the unthinkable. In the span of 2 weeks, we've been forced to close the vast majority of workplaces in Ontario. We've had to shut down most of our economy. We've been forced to limit public gatherings. We've had to close our schools. We've had to isolate ourselves. We've had to make difficult choices, extreme sacrifices. But my friends, when I saw those projections, when I saw how many lives we as a province have been able to save so far, I know we all did the right thing, and I know we'd do it all over again in a heartbeat, because nothing is worth more than a life. So please, this weekend will be nice outside, and I know it's hard to do. I know how difficult it is, but please stay home. Help us write an ending to our story that we can look back on, that our future generations can look back on and be proud of. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Elliott.
Thank you, Premier. From the beginning of the outbreak of COVID-19, we've been firm that the health and well-being of Ontarians must be our #1 priority. We have not hesitated in our efforts to confront this new virus. At the first sign of growing troubles a world away, we mandated the reporting of any suspected or confirmed cases of COVID-19. In doing so, public health units were empowered to take all necessary measures to contain its spread. As I've said in the past, we have benefited immensely from these early efforts. They have meaningfully delayed the spread of the virus and provided precious time for our province to prepare. Time we have not squandered. Indeed, since these early first steps, we've done everything in our power to contain COVID-19 as we build additional capacity in our hospitals to sustain the looming wave of hospitalizations that threaten to overwhelm intensive care units in communities across the province. Over the past several weeks, and on the advice of our Chief Medical Officer of Health, Ontario has enacted increasingly stringent public health measures to stop the spread, culminating in the province enacting a declaration of emergency over 2 weeks ago on March 17th. We were the first province to close all publicly funded schools in Ontario. Long-term care homes, hospitals, and retirement homes have been limited to essential visitors only as we build an iron ring around them to protect our most vulnerable. Workers with COVID-19 or symptoms are now enabled to safely isolate at home with the security of knowing their job is protected. Parks, playgrounds, casinos, and non-essential workplaces have been ordered closed. I've had childcare centers, public libraries, theaters and venues, as well as bars and restaurants. Most recently, we banned public events and social gatherings of more than 5 people, including parades, weddings, and communal services within places of worship. It's certainly not lost on us that these orders have been disruptive to people's lives. But they have been necessary measures to stop the spread of COVID-19. Together, they have contributed to a real and meaningful reduction in the number of expected cases of and deaths from this new virus. At the same time, the province's COVID-19 command table has brought together some of the best and brightest to serve as a single point of oversight to guide Ontario's response. These experts have been relentless in their focus on preparing our healthcare system for the coming wave of patients. They have at all times operated under the assumption that the worst will occur and have planned accordingly. As a result, Ontario has implemented several measures to ensure our continued readiness. Our enhanced and interactive self-assessment tool is providing real-time data as we support concerned Ontarians in determining if they need to seek further care. There are nearly 100 assessment centers operating across the province, helping to relieve pressures on emergency departments and protecting broader patient populations. Telehealth is operating at unprecedented levels of capacity. The province approved new billing codes for doctors to provide telephone assessments, enabling them to support their patients who can now remain at home. And we are enabling hospitals to pursue new and innovative arrangements with retirement homes and hotels, or to build additional capacity through temporary pandemic units. This work to create capacity has also at times called for difficult decisions to be made. Decisions like ramping down elective surgeries. But in doing so, we have created desperately needed space in our hospitals and freed equipment and personnel to bolster our fight against COVID-19 as we urgently invest $341 million more to build 1,000 acute care and 500 critical care beds. As we confront the growing challenge of COVID-19, we will continue to support the brave heroes working on the front lines of our healthcare system. Our nurses, doctors, paramedics, and personal support workers, each one remaining steadfast in their commitment to keep Ontarians safe. We will do the same for them. We are investing in personal protective equipment and other supplies to protect our frontline healthcare workers. Ontario is entering a critical juncture in our fight against COVID-19. Our country's border is closed. Well over 1 million Canadians have returned home from abroad. Now is the true test of how Ontario will weather this storm. The numbers released today are sobering. Critically, they reveal a disastrous path now avoided, but also serve as a call to arms for greater action. This is no time for complacency. We must remain vigilant. We've been preparing for this very moment for months now, but we cannot do this alone. We are relying on every single Ontarian to join us in this battle. Please stay home. The consequences of failing to heed this simple advice are clear. If you don't join us in this battle, our healthcare system would be overwhelmed as total cases would reach near 80,000 by the end of April, with over 1,600 deaths. These are more than mere numbers. They are our friends and family, our neighbors. They are the brave heroes fighting this virus on the front lines of our healthcare system. They are lives full of potential and bright futures at risk of being taken from us far too soon. Most of all, they are avoidable, but only if each of us do our part. Only if you stay home to stop the spread of COVID-19. Nothing is more important. Thank you.
Okay, we'll go to the phone line for questions. First question.
Actually, Yvonne, I just want to address the one thing. I've had a few calls from people. We're saying practice social distancing, and I know on camera it looks like we're a lot closer, but I actually had our people make sure they measured 7 feet away. So I know some people were mentioning to me, hey, it looks like you're a few feet. I guess it's the camera shot, but we're actually standing about 7 feet away.
Okay, first question.
First question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Premier. It looks like you are setting out what I guess we could compare to Dickens' Christmas Carol, you know, the ghost of Christmas future. If we change it, then things can get better. How much further are you looking to go? I get the sense that your announcement of the closure of certain construction sites and other businesses will not be the last step. How much further do you have to go to get to the point that Dr. Donnelly was talking about of full measures implemented to get that number as low as possible when it comes to infections and deaths?
Well, we'll do everything that it takes, Brian, and you look what we've done over the last 2 weeks. It's astonishing, actually. We basically shut down the vast majority of our economy, shut down the schools. Everyone is, for the most part, is listening. They're keeping social distancing, but everything's on the table. And I'll always take the advice of Dr. Williams, Dr. Donnelly, the rest of the doctors. I take their advice, and we're going to do everything we possibly can. In saying that, we have to make sure we have food on people's tables. We do need certain areas to stay open. And that's going to be obviously the retail and the gas stations and the pharmacies and some of the homes. I got numbers today that there's in the next few months there's going to be 45,000 families. Those are families. That's, you know, you can do your multipliers, and that's a lot of people that may be out on the street, and we can't have that too. So as I say, Brian, for every trigger we pull, there's 10 other triggers that are affected by our decisions. And that goes back to my reason why I want to make sure that we're always fully transparent and everyone sees the exact same numbers from the exact same people that are telling me the numbers. But everything is on the table right now. Our number one priority is to save lives right now.
Yesterday, you talked about the need to make personal protective equipment here in Canada, Ontario specifically. You were on the phone with Ambassador Lighthizer earlier today.
Yes.
After the Trump administration said they invoked the Defense Protection Act and told 3M not to ship respirators to Canada. Can you tell us about that call and what this does to your determination to start making these materials in Ontario again after this pandemic?
Well, we had a conference call with the premiers yesterday, and then also a conference call with the premiers and the Prime Minister. And I told all the premiers, along with the Prime Minister, Deputy Prime Minister, never again in the history of Canada should we ever be beholden to companies around the world or countries around the world for the safety and well-being of the people of Canada. We have the technology, we have the ingenuity, we have the engineering might, the manufacturing might. There's nothing we can't build right here in Ontario. And I also mentioned, as we get these companies ramped up and we get through this, we can't be going over to other sources because we're going to save a nickel. Because we might be small in population compared to other countries, but we're giants when it comes to technology, manufacturing, ingenuity, engineering. As I always say, we can build anything. And as long as I'm Premier, I will never, ever let this happen again to the people of our province or our country. I've had great conversations with all the manufacturers right now, as early as an hour ago and last night, seeing where we're at with the N95 masks from Woodbridge. They're doing an incredible job, no matter if it's a reagent or the ventilators. Everyone is pulling their weight, and we're so grateful. But we will never be put in this position again, that we're still relying on N95s. I had a call. I have a very good relationship with Ambassador Lighthizer through the trade negotiations, and I called him today and told him how disappointed I am that they would make this decision. And I mentioned this as the Deputy Prime Minister knows as well, and has a good relationship with the Ambassador. I'm sure she talked to him as well. But you know, we're the closest trading partners anywhere in the world. You know, if you look at ourselves, Canada and the U.S., we're connected at the hip. And I just can't stress how disappointed I am with President Trump for making this decision. I understand, he's thinking I got to take care of my own people, but you know, we're connected. And but even in saying that, I'm not going to rely on President Trump. I'm not going to rely on any prime minister or president or any country ever again. Our manufacturing, we're gearing up, and when those assemblies start, we aren't going to stop them. We'll make sure we supplies for everyone in Canada, not just Ontario. We're the manufacturing engine of this country, and we're going to step up and do everything we can. And I said that to all the premiers yesterday, and we'll continue doing that.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier. Sorry about that. Thank you so much for taking our questions. I just wondered on your decision to further restrict construction. You've obviously resisted that for some time. I wondered why you made that decision now, and what is your thinking behind that?
Well, first of all, I always speak to the labor leaders, organizations, and there's so many of them across this province, and we have such a great relationship, making sure that we speak to our stakeholders, making sure we take the advice off our medical team, our leaders like Dr. Williams, Dr. Donnelly, and Dr. Brown, and our whole medical team. And I saw the numbers, I think it was yesterday, and that was a clear decision. We have to make sure that we shut down every possible industrial, commercial site that we can. Well, we are shutting them down, and to make sure that we protect as many frontline people as possible. We still have to do critical infrastructure, sewers, water. People have to have water. Hospitals are critical. If there's ever a time we need to speed up the construction of hospitals, it's right now. Some housing that I mentioned 45,000 families that...
Thank you. And my follow-up question is for Minister Elliott. Minister, we know how dangerous this is for the elderly population and for people who have family members in long-term care or retirement homes right now. And we're seeing how this virus is spreading, and people are losing their lives. What should family members of these people be doing right now? Should we be looking to pull our family members out of these homes? And obviously there's a lot of difficulties with certain conditions. If you have a grandparent with dementia or Alzheimer's or certain physical conditions, or you just wait it out and leave them in there and hope for the best. What advice are you giving people who are terrified for their parents and grandparents right now?
Well, I know that there are many, many families that are very concerned about their parents or grandparents that are in long-term care homes. In some cases, the family members may be able to take their family member back to their own homes to care for them if they are well enough and if they have been cleared, of course, of COVID-19 symptoms. But that's just not a reality for most people. Most people will remain in the homes, but all I can say to all those families is we are taking this very seriously, particularly with respect to people in long-term care homes, retirement homes, and other congregate settings. We are really trying to build that iron ring of protection around them. So that means we will be doing enhanced testing. As time goes on, we are going to be making sure that there's no visitors coming in, which I know is difficult for people, except in exceptional circumstances where perhaps someone is in palliative care and is not going to make it. But we take this very seriously. We want to make sure that we're going to do enhanced contact testing and follow-up testing to make sure that if there are any signs exhibited in these long-term care homes, we're going to have public health officials deal with it right away. So we want to help families. We want them to know that we take this very seriously and that the seniors, particularly living in these homes, are our top priority.
Next question.
Next question comes from Cynthia Milligan from City TV. Please go ahead.
Hi, Cynthia.
Hi, Premier. I know that you have said that you're going to be shutting down all but non-essential construction, and we've seen the numbers, and yes, the projections are grim. Premier, you're practically begging people to stay at home. Yeah. Do you need to force them to further as the weather gets nicer?
Well, I hope not, Cynthia. Again, I have confidence in the 14.5 million people in this province. If this doesn't give a wake-up call to people, I don't know what does, but I think it's the responsibility of everyone in this province to make sure they follow the protocol that our Chief Medical Officer has put forward, and our other medical team, the COVID-19 table has put forward. I don't know what more you can say other than if we don't do it, we're going to be in serious trouble. The impact on our hospitals is going to be extremely serious, and we have to make sure we follow the proper protocols, social distancing, and just making sure that we listen to everything that Dr. Williams and his team has put forward to us.
What is your breaking point if people aren't listening? If you see this weekend that people are still congregating in parks and beaches, and would you like Prime Minister Justin Trudeau to use the Emergency Measures Act?
Well, that conversation came up with the Prime Minister yesterday, and we all want to try to avoid that. That's real extreme, and I think people are smart enough. And vast majority of the people are, like the vast majority, Cynthia, are listening. You get the odd group, and hopefully we aren't going to see this weekend what we saw last weekend. And last weekend was just unacceptable. And I understand, you have to get out, but avoid the parks. I understand if you just have to walk around the block once by yourself or with your loved one. I get that. You got to walk your dog. I see a lot of that happening. I understand that. But big gatherings in the beach or on the parks, we've shut the parks and the beach down, so hopefully people won't do that. We have to get through this month, and it's not just this month. It doesn't stop in April. It continues, but we have to get through this time frame right now.
Next question.
Next question comes from Sean Jeffers of the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi, Sean.
I wanted to ask you about the list of essential businesses. I know that you'd indicated some flexibility in terms of moving that list lower previously. Now this new list that's been released today goes from 74 categories to 44. I'm wondering if you regret not making this move sooner in light of this data today.
Well, we're moved pretty quick so far. Again, Sean, if you look what we've done in the last 2 weeks, we've basically shut down our whole economy outside of the absolute essential areas. And, you know, we take the advice of our chief medical officer, and we've made huge ground. And I want to emphasize again, when I say we are moving forward, I mean all of us collectively, the 14.5 million people, our government, federally, municipally, and provincially. We've all made tremendous strides over the last few weeks, and we're gonna continue making those strides, and we won't hesitate to take further steps if necessary. But we do have to keep the pharmacies open. We have to keep the retail food. As soon as you take those food off the shelves and close down retail, you get, you know, you get anarchy. You get civil disobedience. People are going to do what they have to do to feed their family, and we don't want to go to that point. We want to make sure the supply chain for food and essential items are open. And I drove by a drugstore the other day, and I saw, you know, they were being responsible. Everyone was lined up outside. They're spaced 6 feet away. I see that at big food retail chains as well. They want to protect their customers. They want to protect their employees. So everyone is working together, and we really appreciate it. And where we can do curbside pickup, we're doing it. One large retailer in the construction, not in the construction, but hardware, I should say, trade, they've jumped from, I don't know, 5 to 10% online curbside pickup up to 30%. They're going to increase that, as all the other big retailers are doing as well, to make it a lot more safe for their customers.
And Premier, if I could just follow up with a question on the modeling itself. I think a lot of people will look at these numbers and think about your comments yesterday saying that, you know, they deserve to know what you know and what's guiding you in your decision making here. I'm wondering how long you've known about the numbers in this modeling and how long they have been guiding your decisions. Well,
yesterday, those numbers you saw, I saw yesterday and you saw today, that's when I saw them. I saw them yesterday, and they've showed us worldwide models in the past, but really, as Dr. Williams beside me here will tell you, with all the people coming from abroad and all the snowbirds coming in, to have some more accurate modeling, we had to give Dr. Williams and his team at least a week to gather some more modeling, and they're going to continue doing it as we move forward. So again, Dr. Williams, you've been incredible, and we just appreciate everything that you're doing and everything all the other health professionals are doing around the table. We have the best in the world giving us advice. You're hearing the exact same advice that I hear, and I'm going to continue making sure that we're transparent. What I hear, the public's going to hear, and that's what we're going to do moving forward, to make sure people are informed, and they'll have decisions to make with their families, their communities, moving forward.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Premier. So you're announcing these strict new measures on essential businesses, and you said at the very beginning that you're taking these steps today as soon as you got the data. But the fact is that the delays in the testing slowed down the data that Ontario had. So if you'd had that data sooner, would you have acted sooner? And how many lives have those testing delays cost?
Well, I look at all the lives that we've saved. We've saved thousands of lives by reacting the way we have, Mike, and we're putting all the resources possible into this. And it wasn't the government that saved lives. The people of Ontario saved lives by following the protocol that Dr. Williams and his team has put out there. You can always look back. I always want to look forward and moving forward. What can we do to even reduce that? You saw some staggering, stark figures today, and we're in a full-out battle right now every single day. But I'm confident if we follow the proper protocols, and I think all the doctors mentioned it today, We're doing everything we can as a government, but that still plays a small part compared to the people of the province can play by just staying at home, practicing social distancing, wash your hands. We've been saying this over and over and over again. So we need the cooperation, which we have. We've had the cooperation, and thanks to the people of Ontario, we've saved thousands and thousands of lives.
My follow-up would be either to you, Premier, or to Minister Elliott. The modeling shows that the current ICU capacity basically is on track to run out next week, and you'll need to add at least 900 beds in a best-case scenario. How realistic is it to get 900 beds, new ICU beds, added in that time frame, and what are you going to do about staffing that? Where are the ICU doctors and ICU nurses going to come from?
I'll pass this over to Minister Elliott.
Well, we are already working at the command table, both in terms of increasing the number of spaces, but also increasing the human resources in order to work in those spaces. Every hospital in Ontario has been given permission to go ahead and add to their capacity in the way that they see as most appropriate. For some of them, it may mean renting space in hotels or motels. Some of them are using space in retirement homes, and some of them are actually creating field hospitals. So they're ready to go whenever they need to increase their capacity, and that's something that's calibrated on an hour-by-hour basis, and depending on where the outbreaks are happening. In terms of human resources, we have set up a website where people can volunteer to help. We've received over 10,000 applications already from people who are ready to staff these units. These may be nurses who may have retired who want to come back into service, medical students who are going to help us with the contact tracing and so on, other volunteers who just want to help in any way that they can. So what we're doing is working with the regulatory colleges to try and get retired nurses, for example, that want to reapply back into practice. We're working with our medical students to get them into the assessment centers or to help with contact tracing. We are very grateful for the many people that have stepped forward, but we are ready to go depending on where the hot spots are with COVID-19 and what each individual hospital needs. But they all have a plan in place right now to expand their capacity, and they're ready to go whenever they need to.
Next question.
Next question comes from Travis Dunraj of Global News. Please go ahead.
Hey there, Premier. I just want to go back to Brian's question from the outset about the masks. And we know that 274 healthcare workers have tested positive so far for COVID-19, and they need PPE, especially N95 masks. The Prime Minister alluded this morning to potential repercussions that would happen if President Trump follows through with this. What is Ontario prepared to do, and how is this going to affect Ontario's trade relationship and relationship in general with the United States?
Well, first of all, with the N95 masks, we have a couple million masks on order with 3M. I'm going to be calling the president after I finish this press conference to ask where we stand on those orders. We have some other sources that we're getting some N95 masks in, and as soon as I confirm it, I don't want to confirm it until we see these masks literally land at one of the airports here or in Ottawa. We've also had a good conversation with the folks over at Woodbridge, and they're producing something better than an N95. It's called an N96, and it's going through the approval stage. We're expediting that all the way through to all the agencies, Health Canada as well. They're expediting it. And once they're up and going, we're going to be pumping these out by the millions, and we won't have to worry about anyone else. That goes, it just shows you, again, going back to the technology and the engineering skills that we have, the engineering might that this province has. I'll put it up against anyone, anywhere in the world. And again, we'll never be in this position, no matter if it's ventilators or N95s or gowns, face shields as well. We're going to be producing the face shields here, but over the next week or so, once we get all these approvals, we're ramping up. And in between then and now, yes, we have to be conservative on the supply, but we do have enough supplies to keep us going. The other area, and again, I'm not a professional healthcare worker, but I've heard a lot of people that aren't in the frontline healthcare areas, they're saying they require N95s. It's kind of like the buzzword out there right now, and some people do have to have the N95s, but there's a lot of people that don't need the N95s. They need the level 2 surgical masks, and we just want to make sure that we watch the supply. And again, we still have supplies coming in on a daily basis, but I'm going to feel a lot more comfortable when we can produce them right here in Ontario.
Just as a follow-up, and I'm hoping that you can clarify what restrictions you are thinking about putting on the United States for Ontario. But as a separate issue, as you know, there are hotspots in Ontario right now for the number of cases we're seeing. Are you considering restricting travel within the province down the road if we see flare-ups, particularly in some communities?
Yeah, Travis, everything's on the table, but how do you police that? You know, it's so difficult. I have to, and you know, I have to rely on the people of Ontario. Don't go to the cottage country. We've heard from people in cottage country. They just can't sustain the amount of people that are going up there. If you're going into the local retail grocery store and you start taking the groceries, the locals won't have much there. The hospitals, I think everyone's been in cottage country, and the hospitals don't have the capacity like we have in large urban areas like Toronto or Ottawa or other large urban areas. So please, just don't travel. Do not travel unless it's absolutely essential for your work. Please, just stay at home. I just can't stress it enough. No matter what we do as a government, if people don't listen, it's not going to be a good situation. So we're
not considering restricting travel?
Well, again, Travis, it's very hard to police that. You know, we have a province that's twice the size of Texas almost, larger than Italy and Germany and France combined. It's a massive area, and our resources are spread thin right now. We have a lot of police officers around our province that are self-isolating. I think I heard the number from Toronto Police. I believe it was over 500 police officers are self-isolating. So it's very simple. And I want to emphasize this, the vast majority of Ontarians are stepping up to the plate, the vast majority. You heard Minister Elliott right now. Over 10,000 people have volunteered to help out on the front lines of healthcare. We have thousands and thousands of companies stepping up to the plate and donating items that we need, helping out in manufacturing these. You know, we have the greatest people in the world, Travis. No one anywhere in the world compares to the people of Ontario and the people of Canada, the most resilient people I know.
Okay, this will be last question.
Last question comes from Heather Wright from CTV National News. Please go ahead.
Hi, Premier. Some of the epidemiologists say that it's great that provincial modeling and projection data has been released, but really to get a bigger picture, we need to see national data. Have you had that conversation with the Prime Minister about making the bigger numbers available to Canadians?
Well, that conversation really didn't come up, and I'm in no position to tell the Prime Minister what he should be doing, shouldn't be doing, and I'm in no position to tell the rest of the premiers what to do. I just personally feel it's the right of the people of Ontario to know what I know, and so I've had to make that decision. It's going to be up to the Prime Minister to make his decision for the people of this country. And it's going to be up to the rest of the premiers to make their decision, and that's going to be up to them. But I can tell you, we're going to be transparent. We're going to show people the same graphs moving forward that I've been shown. And once I see it, one day later, the folks of Ontario will see it as well. So that's going to be up to the federal governments and the other provincial jurisdictions to show their figures.
Thank you.
Thank you so much. Thank you, everyone. Thank you.